Q&A period. If you have questions that come up for you in the course of the panel, feel free to drop them in the chat box and we will address them during the Q&A period. Very, very grateful to have you all gathered here for this really important conversation today. October is Domestic Violence Awareness Month, and it's an opportunity for us to shine the light on this particular topic. Intimate partner violence is an epidemic that impacts 12 million men and women in the United States every year. And today's webinar is really an opportunity to bring together those in the violence prevention field to better understand the topic and think of ways to address it. So as you see here, this is a brief agenda for our conversation today. We'll be going over some terminology, introducing some NNSC research. We'll introduce our amazing panelists and then dive into our panel discussion and our question and answer period. So let's first start off with some terminology as a way to just do some ground setting. Community violence, it most often involves shootings and assaults that take place in public between individuals that are not related, but may or may not know each other. Community violence takes a devastating toll on individuals between the ages of 10 to 34, either being killed, injured, or witnessing violence. And although community violence can impact anyone, it disproportionately affects Black and Latino populations at higher rates. Children between the ages of 10 to 24 face homicide as the second leading cause of death, while young adults between the ages of 25 to 34 face homicide as the third leading cause of death. Let's talk a little bit about intimate partner violence. Intimate partner violence is the use of physical, mental, verbal, and/or sexual violence between people that are currently or were formerly intimate partners. Now, while domestic violence is intimate partner violence, the term domestic violence is an umbrella term that includes violence involving children, siblings, elder abuse, and other types of family violence. For today's conversation, we'll be very specific and focusing on violence that happens between former and current intimate partners. With intimate partner violence, regardless of race, religion, class, or socioeconomic status, anyone can experience intimate partner violence. Yet unfortunately, historically marginalized women are at greatest risk. This risk ranges from experiencing lasting tolls to physical and mental health, or severe injuries, or even death. IPV is also a concerning public health issue, with half of all homicides of women being IPV related. And additionally, approximately 20% of all homicides in the US are intimate partner violence related. We've briefly outlined why the two topics separately are concerning, but when both occur at the same time for individuals, high risk actually turns into extreme risk. While the research about the intersections for both forms of violence is limited, NNSC actually collected information on how this shows up in locations that have implemented our group violence intervention. We looked at homicide and non-fatal shooting data in 43 distinct cities, city segments, and counties across the US and US territories. And from that data, what we found was, on average, 9% of the incidents were IPV or IPV related. And as far as the intersection between intimate partner violence and community violence, what we saw with the community violence incidents, 5% of those community violence incidents were actually IPV related. Now, 5% can actually seem like a very small segment and may not feel as concerning, but the intersection between IPV and community violence may be higher if we had the chance to actually evaluate other data, such as serious assaults and strangulation. Because as I mentioned before, this data specifically looked at homicide and non-fatal shootings. And for those of you working in the intimate partner violence field, you may already know that these numbers may be small because so many intimate partner violence victims may not feel comfortable reporting. Although NNSC's analysis showed that IPV makes up a small percentage of community violence incidents, it did show us that community violence involved individuals greatly impacted intimate partner violence. The data sample showed nearly 25% of all IPV-related incidents in this sample involved a person who was community violence involved. So we understand now that we have a need to have this conversation. So let's begin our conversation today. I want to have the opportunity to introduce our incredible panelists. We're fortunate to have Sasha Cotton, Anthony Smith, and Dr. Monique Williams with us today. Sasha Cotton is Executive Director of the National Network for Safe Communities. She joined the National Network for Safe Communities in September 2022 as a Senior Strategy Director and spent time getting to know NNSC's partners, work, and staff to strengthen and grow the organization before becoming the Executive Director. Prior to joining the National Network for Safe Communities, Sasha led violence prevention work in Minneapolis for nearly a decade, including designing and serving as the first director of the Minneapolis Office of Violence Prevention in the Minneapolis Health Department. During her time as the Minneapolis OVP director, Executive Director Cotton oversaw the design and implementation of a comprehensive community violence intervention approach, which included NNSC's group violence intervention strategy, a hospital-based violence intervention program, and street outreach workers. During her tenure, she played a crucial role in the city as it faced the murder of George Floyd and the unrest that followed. Prior to serving as the OVP director, Sasha served as the National Resource Center coordinator at the Institute on Domestic Violence in the African American community, as well as serving as the prevention program manager for the Violence Free Minnesota, the state's domestic violence coalition. She's currently representing Minnesota on the U.S. Commission on Civil Rights and is the vice president of the African American Leadership Council in St. Paul. Now let's welcome Anthony Smith, who is executive director of Cities United. Anthony is an organizer, a bridge builder, a believer in community, and a thought partner. He currently serves as the executive director of Cities United. Under his leadership, the organization has partnered with hundreds of cities who are working to create safe, healthy, and hopeful communities for young Black men and boys and their families. Before joining Cities United, Anthony led the Office for Safe and Healthy Neighborhoods for Mayor Greg Fisher and the city of Louisville. All throughout his professional career, he has made a priority of creating positive outcomes for youth and cultivating up and coming Black leaders. Let's also welcome Dr. Monique Williams, Executive Director for Cure Violence Global. Dr. Williams is an accomplished public health professional, researcher, and practitioner specializing in violence prevention. As the Executive Director of Cure Violence Global, she spearheads the organization's significant growth and international expansion. In her previous role as the Director of Louisville Mayor's Office for Safe and Healthy Neighborhoods, Dr. Williams spearheaded the development and implementation of the city's strategic plan to reduce violence, incorporating the Cure Violence approach. With extensive experience in academia, Dr. Williams has served as a community-based participatory researcher at both Texas A&M University and the University of Louisville. Her research focuses on improving health outcomes for marginalized populations through community health development, equity, and violence prevention strategies. During her tenure as director of the University of Louisville's National Center of Excellence in Youth Violence Prevention, one of 5 centers designated by the CDC, she championed academic and community expertise to integrate practice, research, and teaching, advancing racial justice, health equity, and youth violence prevention in partnership with local communities. So very big thank you and welcome to our panelists. And I'm going to stop sharing screen so we can dive into the actual conversation. So, Sasha, Anthony, Dr. Williams, tell us, what are people actually seeing on the ground when it comes to the intersection of community violence and intimate partner violence?
Okay, who's gonna start us off? I'll start us off. Um, so when we talk about, the work that's happening on the ground, I'll first kind of start with um kind of a category of worker that we're going to be talking about throughout the discussion today, and that's our violence interrupters. And so these are essentially frontline workers who focus on reducing violence in their communities, right? So they build relationships in their communities, or they already have relationships in their communities with those who have been placed at the highest risk for being either perpetrators or victims of violence. They mediate conflicts. They provide anti-violence messaging to those who need it most, but to the community in general as well. They respond to critical incidents in their communities. They mentor those that are at highest risk for violence. And so, right, they are really engaged in their community in a way that, makes them kind of well positioned to support the decreases of violence that we want to see in our communities. And so, with the way that the concept of violence interrupter emerged, for us as an organization, we had really been focused on like gang related and community based violence, but kind of this element of IPV hadn't necessarily been a focus. However, it's something that comes up in the work all of the time, right? But it's not something that I think our interrupters feel equipped to address. A lot of times it is a cause of some of the violence that we see in the community, right? You do something to someone's mother, sister, cousin, and there's a retaliatory act that follows, that could lead to death and or injury. And so, right, sometimes they are actually addressing retaliatory events that are caused by intimate partner violence, right? But like nobody is really focused on like that element or addressing that element to ensure that there's no further violence that happens. And so we see it all of the time. It's never been made a focal point to address in this kind of work on any large scale up until this point.
Yeah, thank you, Dr. Monique, for framing that, and then thank you, Sasha and team, for really pulling this together for us. And I think as we start this conversation, thinking about the two Black women who are on this call, who are leading national organizations that are also helping us broaden our scope and think more broadly about what violence is in our communities and how we address it. And I think when you ask the question around what are we seeing from the field and hearing from the field, Cities United supports local governments and community-based partners that's putting together comprehensive strategies. And anytime you bring a table of folks together who are focused on creating safety in community, intimate partner violence pops up and comes out, right? I think at the end of the day, the focus has always been, as Dr. Monique said, on community balance, but there's always folks at the table saying these things connect and we need to make sure that we're having a broader scope. I think for too long, the field has focused on what has been like what's right in front of us and what's important. But I do know more and more communities that we're working in, the conversation is being broader. I can reference Toledo. We just helped them put together their Peace in Motion plan, which is around reducing homicides and shootings in their communities. But they also there was enough interest and enough push at the table to say, hey, we've also got to think about intimate partner balance as well, right? So they're now putting together a work group to see how that intersect and how they bring it to the table. So as Dr. Monique said, I think the conversation has always been there. I think folks are now creating space to do both and. But I do think, when you think about community balance interrupters, their job is to reduce community balance. And how do they stay focused on that, but then also partner with those who do the other work so that we can have a broader table and a broader scope. So there's always been a concern. There's always been what can we do about it and how do we do more? And I think, having folks in leadership like Tasha and Dr. Monique can help us think through that a little bit broader and get us to a better place.
Yeah, and I'll just add, I mean, both from my work in Minneapolis and now at the National Network, I think in the group violence intervention space, we definitely are seeing the issue of intimate partner violence all the time, right? Both with the clients that we serve and the interpersonal relationships that they have, but also to Dr. Monique's point, as a driver of violence, that the domestic violence that happens, whether it's between a couple, and one party is, someone's protecting someone involved in that couple, or as we know, the complications of relationships and how many disputes and retaliatory issues in communities start over intimate partner relationships that sometimes include violence. So the nuance here feels really important to talk about and to better prepare, whether it's the support and outreach folks through the group violence intervention, violence interrupters, and others, to begin the conversation with clients and the communities that they serve about the existence of intimate partner violence, because I think that's a start, right? Historically, it hasn't even been a question we've necessarily been trained to ask is there violence in your relationship? How are you navigating that? What supports could be offered? When we're doing intakes with clients for community violence intervention strategies, and just sort of thinking about the data, we know how disproportionately community violence and intimate partner violence impact Black and Brown communities. And so it can't be the quiet killer anymore, right? We have to find ways to talk about it and get our community to talk about it. It has historically been a thing that we've said, like what happens in someone's house stays in their house. And I think it's time out for that. And I'm excited for the conversation to have today.
Thank you all. I guess let me take a step back and ask, what do you think would help violence interrupters or any practitioners in the community violence field feel prepared to have a conversation about intimate partner violence? What's needed to feel comfortable, to feel ready and resourced?
I can start. I think really it's around education, like educating folks on what it is and what it's not. And then also around the resources that are available to you to get the help that you need. Because I think at times, we're talking about folks who are credible messengers trying to build relationships in community. How do they manage and not be seen as somebody who is snitching on folks and telling on folks inside of this, but still get the help that they need? So I think there's some education around what the issue is and how it shows up and how to recognize it, but then also who do you get to help and support you along the way as violence interrupters. But I think it's not only just violence interrupters. Again, when we think about the ecosystem, I think about folks who, like Sasha, Dr. Monique, and myself, who used to run offices of violence prevention and community safety. What role do we play in that, and what supports do we provide and support, right? So I think it's the education of the whole field and all of us who play a role, but also I think as you all put your report out, it's just helping elected officials understand the connectivity between the two so that they can also understand what their role is and what they can do, right? So I think it's education across the field, helping people understand what the supports are, and then helping folks get connected to those supports would be a great way to start the conversation and to continue to move the conversation forward.
I would agree. Every time I think about this, it still baffles my mind a little bit that we do, for us as an organization, we deal in gender-based violence, which is just violence against women and young girls. However, that it doesn't translate here in the U.S. or hasn't yet. That's where we're moving. But in our Latin American countries, right, our trainings are adapted to address this kind of violence because we couldn't see reductions in the ways that we needed to see reductions without addressing this kind of violence, and this coming from also community as well as the data. And so our trainings there are adapted to include concepts like the lens on gender and gender norms in relation to violence, engaging in different techniques for engaging norms around gender-based violence and intimate partner violence, and then establishing ways to do mediations that involve IPV. So there's a whole like training that has to happen for those of us that are in this field who just aren't necessarily used to engaging in this way. And then, right, there's this whole need, right, to address norms, period, as it relates to how people perceive, you know, women and how women should be treated in our communities.
Yeah, if I can just jump in, I think the key word here is normalizing. It's normalizing the conversation. Historically, I think that there is just a discomfort in talking about this kind of violence. I think there is a lack of understanding from many people about how this shows up. Now, don't get me wrong, many of us are seeing it in our work. We've seen it in the communities and families that we've grown up in, but it has been something that we've been taught is sort of a private matter. And I think that sort of deprivatizing intimate partner violence and getting more people to say and have the same level of outrage that they have about community violence, particularly in the most impacted communities about intimate partner violence, is going to be a really important key. And to your point, Anthony, a lot of that starts with education. People don't know the rate at which it's killing Black and brown people and women and men, you know, across the board. But I was just looking at some statistics. And when we think about the disproportionate impact of the criminal legal system, Black women are 80% more likely to be convicted for killing their partners. So we think about sort of systems involvement and why this is important. We know that Black women are being incarcerated at higher rates than other women across the country for a variety of things. But this is definitely one of the issues where we're seeing more Black women being criminalized because they're lashing out against their batterers. And approximately 40% of Black women experience domestic violence over their lifetime, right? So when we talk about community violence, we know that the conversation is often very rooted in urban communities and Black communities. And this issue is happening in almost a similarly prevalent way, and we haven't been having the conversation. And so how do we get mayors, elected officials, community leaders more bought into seeing this as being their business? I think is a really big conversation part that we need to have. And I think that does start with education and the normalization of the conversation. It took us a while to get to a point where we normalize standing against gun violence collectively and saying that it's not okay. It's not okay in our communities. It's not okay for our children. And I think we can build the same narrative around intimate partner violence in the communities that we serve.
Sasha, I really appreciated what you said about, you know, intimate partner violence often being seen as like a private matter and not being discussed and talked about. I wonder if you all can share your perspective on how intimate partner violence has impacted community violence. You know, if you're in environments where intimate partner violence is accepted and normalized, what does that mean for individuals in participating in other forms of violence? What does that say?
Well, I'll jump in because I know we've had some conversations about this, and Fatma, you and I have talked about this, but we know that violence is a learned behavior. People learn it at home, they learn it in the community, they learn it from media, and it's not spliced in some particular way necessarily, right? That if you learn that violence is a good solution, a successful solution to solving your problems, and you don't have other tools, it's easy to fall back on that one tool. And you'll fall back on that one tool at home. You'll do it at the community level, you'll do it in your schools, because as long as it feels like it's working for you, why would you make the shift, right? And so I think part of it is about acknowledging that violence is a learned behavior. And unfortunately, in many of the communities that we work and live in, our kids are learning it. And we know that kids who grow up in homes where domestic violence is prevalent have an increased rate of being involved with youth violence and community violence later in life. And so it is about addressing the pipeline early on and creating, you know, Anthony, thinking about Cities United and the focus on healthy, hopeful communities. Communities can't be healthy and hopeful if violence is happening in the home or outside of it. So I think that that's just it's where we're at. We've got to get honest about it.
I think that's
Yeah.
right, Doc.
Okay.
Go ahead, Dr. Monique.
Good. I was just gonna say, like, for me, right, so we know violence is it's a learned behavior in all of its form. It's learned and it's normalized. And so when we think about strategies for addressing these things and shifting norms, this is why like norms change is important. And so maybe I'll be a nerd just a little bit, right? So we have these two kinds of norms that exist, right? And you have your subjective norms and you have your injunctive norms. And basically your subjective norms are your perception of what people close to you think you should do. And then your injunctive norms are the general approval or disapproval of certain behaviors in society, right? And so both influence how we make decisions. Just your subjective norms are more personal to you, even if your perception is wrong. And your injunctive norms are in relation to how society perceives things. And so I'll frame this in a way that we want it to be framed. So on the subjective norm side, from a personal perception perspective, if, you know, a man believes that the people he cares about, friends, family, whoever's in his close circle, think it's wrong to commit intimate partner violence, you know, he might feel more pressure to stop or to intervene in that, right? And so there's this fear of judgment that exists. And so if he thinks his peers would disapprove of him acting violently, or staying silent during a violent act, then he's going to choose to intervene to avoid that negative judgment, right? And so that's the truth on the other side as well. And if we think about injunctive norms, which reflect, you know, broader society views about violence, and if society strongly disapproves of intimate partner violence in a way that is very outward and standardized, and open about, you know, the importance of nonviolence, you know, a person, a man, anybody would feel maybe more motivated to act against it. And so that's where it's important to have, you know, our community leaders, our media, educational campaigns, like you just talked about, that emphasize, right, that this is wrong. And so it reinforces the idea that there should be intervention or help given to stop something like this from happening. Right. So it's not just within a person, but it's also what's happening outside and around that person. And so in the same way, right, it's the same work that we do as it relates to community violence. We're shifting and we're saying that this is not normal, right? We're shifting the behaviors around it. And it's like we have to apply those same things as it relates to this violence in particular as well. And we have the tools and resources to do so.
Yeah, the only thing I would add to this piece of the conversation is I think, you know, based on the data that you and Sasha both shared, right, is that everybody who participates in community violence is not doing intimate partner violence, right, and vice versa, right? So how we educate folks on understanding the signs and recognizing when both are happening, I think is going to be key to this conversation too, because I don't want us to walk away and think that they're all intersecting all the time. And I think we just got to be clear that everybody who, and especially if, you know, Sasha's number, like 40% of Black and brown women experience intimate partner violence. That number is so much bigger than the 5% that you showed, right? So how do we really start really thinking through not only the intersection of the two, but also just that we got to have a different conversation around intimate partner violence as a whole, that can be tied to CVI and community violence, but also just needs to be having a conversation in the Black and brown community. If we're talking about creating safe, healthy, and hopeful communities, then that means everybody needs to feel safe, healthy, and hopeful, and this is what it looks like. And then how do we create those norms that Dr. Monique was just talking about, where folks know that it's wrong and understand that it's wrong and that it's not accepted by anybody. So I just wanted to make sure that we can make sure that folks don't walk away thinking that, you know, if one happens, then the other one's also happening at the same time, but that you got to really understand the signs and be looking for, and especially we're talking about CBI workers, right? If you go up on the scene, you're going to have to be able to decipher what's taking place. Not only how do I diffuse this issue that I'm dealing with right now, are there other signs of other violence taking place in that household that I should be aware of? And then where do I go get help and support to address that issue?
Yeah, I think, you know, when I was working on the domestic violence side of the criminal legal system, one of the things, and I'm gonna be careful about the term because it's slightly outdated, but most men don't batter, but most batterers are men, right? So the term batterer is sort of an outdated term. So for those of you in the field, forgive me, but I'm saying that to say this ideal about informal social control, the things that you talked about, Dr. Monique, are so critically important because overwhelmingly most men don't agree with this behavior, but they're not always necessarily calling it out when they see it amongst that 10 or 20% of the male population that is using violence in their relationships. And so how do we normalize men in general having the conversation, and particularly knowing that so many of our violence interrupters are men? How do we get them to a place where they feel comfortable calling it out when they see it in their work and in their personal lives? Because we know that that's going to protect women in the community. And we know historically that has been such an important part that at times has been taken from Black men by society, the ability to protect Black women, brown women, women in general. I also just want to call out the national statistics, right, is that 1 in 3 women will experience domestic violence over their lifetime, right? And that's reported cases. We know that domestic violence is dramatically underreported. And so all of these numbers are likely quite low compared to what the actual experience is, but 1 in 3 is high. I mean, if you look at the fact that we have 90 people on this call, I don't know how many of them are women, but that's a lot of people just in a space that we're sharing who have likely experienced some form of intimate partner violence. And it's just not okay. And so how do we name it? How do we not wait for October to talk about it? October's Domestic Violence Awareness Month. I think a lot of the times it gets overshadowed by Breast Cancer Awareness Month, which is also super important and near and dear to my heart. But how do we normalize this conversation in the context of violence prevention? Because it is violence prevention.
Thank you for saying that, Sasha. And I guess my follow-up question for you all is, how do we normalize this conversation, particularly for violence interrupters who've worked many years, decades, establishing strong relationships and partnerships in communities to disrupt and interrupt community violence. But now, if we're asking folks to also address intimate partner violence, how are we able to support violence interrupters hold on to their credibility in disrupting community violence, but now adding this extra piece of intimate partner violence, which again is still considered very personal and very behind closed doors for many communities?
I would go back again just to this education piece, right? I think as we continue to train and support the training of violence interrupters, adding this conversation to it, right? Because I think, again, folks on this call do a lot of training of the folks who actually are practitioners of the work, making sure that it's a part of your training process and really is training on the recognition of it, how to intervene in it, but also how to get the support you need and get the right services. Because again, you don't want to cause more harm, right? So you're making sure you're not asking folks to do things that they're not comfortable with, but you're giving them the tools of how to address it in a way that will be helpful to them and the situation, right? So I think it's about our trainings that we do, are not just again for the VIs, but everybody in the ecosystem that supports the CVI ecosystem. That goes to the director, the OBPs, and community safety officers. That goes to mayors and elected officials. We've got to have a broader conversation so everybody sees the connectivity, but also know what the solutions are and who can help best address those issues.
I would agree with that. And I would say, right, like we want to kind of improve training in this area because it's necessary, but we don't necessarily want, right, violence interrupters to, right, become those who are now just like focused on domestic violence, right? That we have so many trained professionals in IPV, and so it's learning, right, what resources are already available in our communities in relation to that, so that they can also support. So it's probably that also needs to happen, like building bridges and relationships between those that do IPV work and those that do community violence intervention work. But then also too, looking at the thing that makes violence interrupters super amazing at the job that they do, right, is their credibility in community. And that credibility may change with this type of issue. So in the same way that we have to like adapt in concept for different kinds of violence in the work that we do, you may have to maybe adapt even in your category of worker when it comes to this specific type of violence. You know, I always like to share about our work around political violence and the fact that, you know, our violence interrupters in that work are like an ex-KKK member, right? Or the pastor from the extreme right-wing church, or the guy who owns the gun shop that everybody goes and buys their weapons from, right? And so like those are the people that have credibility with the individuals who want to go do things that happen on January 6th of this year, right? And so thinking about that in the same way. And you know, from again, this is our Latin American based work, like the category of worker. It's a lot of this, it's similar, but it's more so like anybody who has a title of like informal leader in the community. And sometimes that's like a faith leader or a leader of a women's group, somebody like in our communities, an elder. And sometimes our elders can say the craziest thing, but nobody's going to say anything to them because it's like they have the right to say that thing. And so it's like that same kind of person in community where it's an unpopular conversation. Somebody may not want to hear it, but because that person has that level of credibility, they can begin that conversation. So it's also, right, a new way of looking at what could, you know, your violence interrupter or outreach worker look like, or what characteristics have to be present for that person to be able to intervene in this kind of space. So I think that's another critical component to think about in this as well.
Yeah, and I think some of it is just about being strategic around leveraging the tools that we already have. And so, you know, I know in some of our sites that are doing a little bit more deeper work around the intersections, in their intake forms, they're asking, you know, do you live with your partner? Do things ever escalate to violence? Do you guys have trusted people that support you when those things happen, right? Because we also know, and we deal with this in the GBI work, right, that the relationship to law enforcement can cause people to have angst, right? And so if they feel like, oh, if I admit that we have domestic violence going on in the home, what are the consequences? So we want to be careful to help people identify the right supports for them and their families. That's not moving away from holding people accountable when they break the law, but accountability looks different. And we want to, I mean, if we're there to serve people, we want to make sure that we're serving them first and foremost in ways that keep them safe, but also in ways that help them to feel supported and connected to the resources that are going to move them beyond the violence. And so I think putting on my hat as a former OBP director, thinking about how do we pull domestic violence agencies into closer relationships with offices of violence prevention, because I think so often we're really focused on the community violence, trying to drive down the shootings, because we know that that is what the public safety concerns are often focused on. But thinking about building out those relationships, certainly with new offices, having that be a foundational part of just knowing who's providing domestic violence services in your community, having existing relationships with them, perhaps having them come in to do trainings with your violence interrupters or other CVI agencies. We are also starting to launch some of that kind of training. So Fatma, I know you were out on the road last week doing some training. We don't have to get into the specifics of where, but I think it would be great for you to maybe give us just a high level overview of how that went with a cross training between CVI and domestic violence workers.
Sure, absolutely. You know, our work has seen that there are these intersections, and as such, we need to bring these two separate fields together to address a common issue. And we had the opportunity to bring practitioners from the community violence field as well as domestic violence field together to have conversations, to build bridges, understand what each type of violence is, I think oftentimes that's the setting of it all. Like, as DV advocates, understanding what community violence is, and as violence interrupters or credible messengers, understanding what intimate partner violence is. By being able to share knowledge, have that common language, you're able to build bridges and be able to talk about how do we problem solve this together? Because this is coming up in the DV field and this is coming up in the community violence field. So it's really an opportunity to, start relationships, build conversations on, okay, we know that this is something that exists. Now I've put a face with a name. I know that I can call this organization for support. Dr. Williams, to your point earlier, we don't necessarily want to say that violence interrupters have to be IPV specialists and do all the intervention work, but be able to understand who else in the community can they call when an IPV situation comes up. What do they need to consider? What do they need to think about? So I think it was a great opportunity in being able to bring these two separate fields together to basically a roundtable of how do we do this together? How do we get to know each other as people and identify that common ground of we're really concerned about these individuals that fall into this intersection, right? The individuals that when there is this intersection, not always, but sometimes, between community violence and intimate partner violence, things go from high risk to extreme risk. So how are we using our resources from both sides, from both fields, to navigate this, to intervene and disrupt the violence? So that's one thing that we're starting to do in some of our sites. I'd be really interested to know from you all as well how you've been able to bring, practitioners from different fields together to have these conversations. I think sometimes there's a comfort zone in working in our own area and field. How do we invite other people and lean in on their expertise and knowledge to support each other?
Just to jump in on that, I think so. When I started the Office for Safe and Healthy Neighborhoods in Louisville, they charged me with helping to reduce homicides, suicides, and overdose. All important work, but way too much for one office to focus on. So I think to your point, it's like my first thing was, okay, cool, let's figure it out. Let's try to work this out. But then I realized that there were already tables pulled together looking at suicide prevention and looking at overdose prevention, right? So I just engaged tables that were already there and asked them what their goals and their what they wanted to see happen in that industry, so I could then be a better advocate. I think to Sasha's point, one of the things I think we got to continue to add to this conversation as the government office that's focused on this issue, because they can help you at least rally the resources and rally the folks who are doing and use their convening power to bring folks to the table. So I was able to get those two groups to take on those issues, and then I was able just to focus on community violence and the homicides and the shootings, which I think helps the work stay focused, but we were still connected because I was the one convening those tables and having the conversations. And I think it's the same here, right? I think, that's been said a lot on this call, like identifying the folks who are already doing the work, bring them to the table so that you can have a more broader conversation and understand what their needs are, what the support is needed, and then also how do we do some training back and forth, some peer-to-peer learning with each other so that we're clear about what the work is. Because again, I think Sasha said it earlier, it's like all of this is happening in the same communities on the same blocks, and being able to have the right resources at the right time, I think is the key piece to this. And I think, when you're thinking about the day-to-day work of a community violence interrupter, their job is just that, right? There's all these other things I could think about, but my job is to save the life of this person that's in front of me and do the intervention and the disruption work that I need to do there. And then by the time I go home, I might have seen some stuff, but I just didn't have time to document it, didn't know who to call, and I moved on to the next thing. So even just creating space for folks to debrief and not only asking questions on the intake form, that Sasha said, even in the debriefs that you do with your team, did you notice any of these kind of things taking place? so that we can start building more information to share with our partners. So I just think it's, again, the convening power and convening the right folks and learning about who's doing the work in your community.
Yeah, and I would just add, I mean, the CVI space has been around, not necessarily being called CVI for a long time, but it has been around and in existence for a long time. And the domestic violence movement has been around for some decades as well, right? And so I think from a formal standpoint, the domestic violence movement really pushed to do formal organizing, right? To lift up policy agendas, to organize around creating, consequences, rules, police units around domestic violence. There's still a ton of work that needs to be done there. But one of the things that has happened is that every state in America has a domestic violence coalition. And so for those sites that are wondering where to start, that may be a place to look to for those CVI agencies, is to identify the domestic violence coalition in your state and connect with them about who in your region or your city or county is doing good domestic violence work, and make that linkage. I always want to make, the conversation tangible. And so that's something that people could do today, this week, next month, is to Google the Domestic Violence Coalition in your state and begin to make that relationship happen so that you can have some baseline information for your staff and begin to have at least some high-level conversations.
And I just ditto, right? Because my thing is just the collaboration. And Lord knows that there are enough people getting together and different coalitions around different things. But I mean, start with your data. And I think, the work that you all are doing, Sasha, in looking at the intersection to give people a data starting point for where these two and what that intersection looks like on a broader scale. But folks can look at what that intersection looks like in their own spaces, and then begin to see what resources should be put forth, or who and what needs to be at the table to address it in their context locally.
Thank you all. This has been fantastic. I'd love for us to transition into the Q&A period. So we are just going to take some questions. And if anyone has questions, feel free to raise your Zoom hand, drop it in the chat box. We'd love to have you a part of this conversation.
I'll just add why people come up with their questions. Mike McLively from Giffords just dropped a list of all of the domestic violence coalitions. There's a link in the chat. So easy access for those of you who are looking to find out what coalitions exist in your state.
Thank you so much. I'll ask another question as we wait for questions to pop up. What do you think what type of training would be helpful from the domestic violence field? What type of resources and referrals? What are folks seeing in communities as the need? Sometimes, as mainstream agencies, mainstream systems, we have a certain idea of what the need is, but what are some of the things that the DV intimate partner violence field can do to support those that are in the intersection of CV and IPV?
I will give my high level. Oh, go ahead, Dr. Monique. Go ahead.
I was just gonna say, right, like, because that's not like my field or area of expertise, so I do not want to speak on behalf of those with the specific expertise in that field, other than to say, right, it would be and could be beneficial for them to step into and learn and understand the CV space, and how some of the strategies operate, because then they can begin to kind of overlay what they do or identify places where resources, ideas, or strategies can be leveraged within what they do, so that wheels aren't being new wheels aren't being created on our end. But yeah, I think that, just kind of a co-learning space, but between the two kind of fields is a good starting place so that people can begin to have those conversations together is a thing that I would say without expertise in that specific area.
So I want to call out some of the hard stuff, and I'm going to encourage my colleagues from both sides of the field. I feel like I'm uniquely experienced in having worked in community violence and domestic violence to be able to see some of the challenges that I think exist for practitioners on both sides. So when we think just on a very basic level, when we think about domestic violence, the recipient of those services are generally overwhelmingly women. And when we think about community violence, the recipients of those services are generally men, right? So that there's already a real difference in the way that those two sides of violence prevention are engaging with and serving their clients. And I think that both parties, both entities want to see the violence stop, want to see the violence addressed, want communities to be safe. I also think that there can be a real reluctancy from CV agencies because the domestic violence space has really leaned in to the legal space of wanting people who cause harm in domestic violence settings to be prosecuted and held accountable. And I think that that is a conversation that has to be had, is how will we walk this line? Community violence intervention folks are thinking very globally about, violence happens every day and it's not prosecuted. No one is arrested. Harm is caused. And the same thing happens in domestic violence, but the law enforcement community has been pulled in a different way. And I think that that can cause some challenges, right? I don't think that they're insurmountable. I don't think that they're impossible. But I do think how we engage with law enforcement in the community violence space as it compares to how we engage with them in the domestic violence space is a conversation that we'll have to have in order for these two sides of the violence prevention world to have some agreement about how we provide services, how we partner, and how we get along, because the core objectives might feel different. They might feel different. And I think that that will be an important conversation starter. But I see we have a question in the chat too.
We do. We see there are a couple of questions. So one of the questions was, how would we actually want violence interrupters to intervene in an IPV incident? Do you all have suggestions, whether that intervention is with the person that's causing the harm, with the victim survivor? What are some initial thoughts?
I think it goes back to the question you just asked. I think it's that one, I would not want folks just to interrupt today because it can cause more harm, right? I think there's training that needs to be involved with it. And I think, again, I'll go back to this idea of knowing the right people to call, right? It's like, when do I interrupt and when do I call somebody else to help me understand the situation and the issue? So I think, just tying it back to the question you asked, I think, folks need to understand what the signs are, right? So the IVP work can help start talking about what the signs are, how to recognize them, who to call, and things like that. So I think I think we're still trying to figure out the nuances of how and when violence interrupters actually intervene and interrupt in this model. But I think it's a piece that's going to have to be more training is going to have to happen and more conversation is going to have to happen before you just tell folks to run in and start doing this work, right? Because I think, again, the goal is to save lives, not cause harm. So how do you make sure people have the right tools they need to do that would be my first reaction to that, because I don't have a definite, this is how you do it. But I just think you got to have some awareness that it is happening and that that there's resources to get to people to.
I mean, I think one way, and violence interrupters, I think, do some of this, certainly with support and outreach and GVI, we do some of this. When we think about the temporary relocations that we do, when guys are high risk, a group violence situation or a community violence situation, We sometimes relocate them temporarily to a place that's safe until we can de-escalate that situation. And in the domestic violence space, we lean into shelters to relocate women, usually women and children who are experiencing domestic violence and need to be removed from their batterers or abusers. I think one way we can think about in the CVI space is helping individuals who are on CVI caseloads, if they recognize that they are feeling triggered and are potentially going to be involved in a domestic violence incident, maybe they're not receiving DV services yet, but they are involved with a community violence intervention program, having them be able to call that program to say, things are getting really escalated at home and I need an out, right? Like, I don't want to hurt my partner. I don't know what to do in this situation. And having CVI workers have enough baseline training to respond to that with seriousness, versus being like, well, I don't have any tools, I don't know what to do, or this isn't my issue, right? Which I think is probably more the concern. Encouraging guys who are getting CV services to reach out if they're having an intimate partner episode and want to be removed from the situation. If they want to say, I need an out, I need a hotel room for the night, I need a ride to my mom's, you know, I need some place to go. I think that that's one helpful tool that lots of places could start to think about.
Yeah, I would say, right, because I read that as like an active situation, like if folks are fighting or something in front of you, I think resort to the current training that you have as far as what you would do in any case of interruption, if in that situation, right, you believe you have the ability or the credibility to engage, right, and use the methods of persuasion to say what you need to say to de-escalate the situation so that no one is further harmed in what's happening, right, and whatever you have to do to, right, like get people out of the same space. Right, so you use what you have in that way, but also agree with Anthony, right? Like there is a dearth of training in this area. Like it's an area where we need to improve training. And so as we're, having these conversations and moving to the place of awareness that this is an issue and an issue that comes up for our interrupters, right? Like folks like me and other organizations moving our trainings to address this issue so that, our violence interrupters are more equipped.
And what I'm hearing everyone say is that it's a range of like crisis intervention, right? And then long-term work as well. And that long-term piece can take time about establishing new social norms, but that crisis intervention piece can be like, what do you need to do to de-escalate the situation so you're not physically harming your partner, and being able to have tools to speak to that and put it there. We have some comments here. Shamika, you mentioned that you often don't see intervention resources available for youth that are in the household witnessing DV. It would be helpful providing supportive services to reduce the risk of cycle of violence being repeated. I wonder if that's part of what our panelists have been speaking about too, is having some general message about intimate partner violence, right? Normalizing that it's not acceptable, it's not okay. What resources, what messaging is put out there to entire families in regards to community violence is not accepted and intimate partner violence is not accepted either. We also have folks talking about the pathway forward requires acknowledgement and co-creation, which is time, effort, and faith. I think that is very well put and well said. This does take time. It doesn't happen overnight. But to your point earlier, Dr. Williams, about not having to recreate things from the start, there are a lot of pathways. There's a lot of foundations in place where people can intervene, do really good work, but it is about getting the right people at the table to intervene and share those resources. Looking for
jump in real quick,
yes,
just on
please.
that point. I think what we also got to think about too is not only that it's going to take time, effort, and faith, it's also going to take resources, right? So we're going to have to be able to talk to funders who support differently when it comes to these two issues as well, to say, hey, we as a field see that there's a need to have joint funding and merge funding. So I think we're also going to have to be able to talk about that. And I think one of the things that I think Sasha said too is that we also got to start thinking about the policy implications of all of this too, right? So what policies do we need to be thinking about and putting in place that allow these two issues to coexist in a way that we are all talking about too? So I think resources and policy are going to have to be a big part of this conversation as well.
Thank you. That's so important. We have one question here about what happens when law enforcement may drop the ball on intervening after you make a referral.
Could we maybe get that person to clarify a little bit more about what they mean around dropping the ball?
Maybe we can ask Elle Turnley to unmute.
Yes, what I mean by, like, if you're a credible messenger and you refer someone to law enforcement who has been involved in domestic violence, and they drop the ball by not getting someone housing or separation, and they wind up, getting violently attacked. What does that do to the credibility of your credible messenger when he was the one who referred it to law enforcement?
Yeah, so I'm gonna try to take a run at this and then I'm gonna invite my colleagues to jump in here. I think it's twofold, right? Like, we know that all of these systems come with their shortcomings, and whether it's domestic violence agencies, CVI agencies, or the criminal legal system, none of it's perfect. I do think it's about the tag teaming effect. So yes, connecting them with law enforcement for the protection and accountability, but then also really trying to make sure that we know about the social services around domestic violence in that community. Because I think that's where the greater long-term support for people who've experienced domestic violence is going to come from. And sometimes that, the referral game is so tricky, right? Because you think, oh, if I refer somebody here, they're going to get the thing that they need. But every agency is different. And so I think really building relationships with a domestic violence agency that solidly does good work and meets the needs of the clients that they work with is so important as we think about this strategy. Because I do think, more than in the CVI space, we think that law enforcement is the right resource for domestic violence. And sometimes it is. But so often what people are really looking for are the resources they're going to get from a domestic violence agency versus law enforcement. And law enforcement may themselves not know about all of the resources that are available. So I think, yes, connecting them with law enforcement if they want protective orders, they want to file charges, all of those kinds of things are going to happen from a law enforcement lens, but definitely connecting them and getting to know the DV agencies in your community is going to be equally, if not more important. So that's sort of my thought about it, but I would invite my colleagues to say anything else too.
I'll just echo that last piece around relationships matter, right? And when we're in both of these, when we're talking about referring folks to services, you got to have it's not a cold handoff, it's a warm handoff. Right. And folks have got to be ready to move when I bring you to folks, right? So making sure that you have strong relationships, which is again why we've all been harping on this idea of bringing both tables together. Because I need to know who you are, I need to know what your capacity is, I need to know how you move, so that if I'm in a situation, I can call you and know that you're going to be there, and so that doesn't mess with my credibility to the way that you just talked about. And I think, when we talk about law enforcement, we all know how the issues that we've had with law enforcement before. And it's like, again, those are relationship based too, right? Who on the law enforcement and the law enforcement agency do you know who would respond, who would come, right? So even getting to know the folks in your district on the beat or whatever they call it, so that you know who to call on when you need them, so that you're just not calling anybody, right? So I think that goes back to just building those strong relationships again.
Yep, and just having a system in place for this, right? Like it's a newer conversation, though clearly, the experiences are being had and people just don't know what steps to take. And so developing that process, and like Anthony said, in all the work that we do, in any resource that, any of, VIs or outreach workers connect folks too, you don't just like call and refer, or you don't just send. Generally, you have to do the it's like a hand holding, like you do it with them to ensure that it actually happens. Now, when you talk about that type of engagement when it comes to law enforcement, that's a nuance if you're somebody who is like a VI or an outreach worker, and even your credibility and even engaging with law enforcement. So again, like, what does that system need to look like to keep you safe, to keep the individual safe, but to also save your credibility so that you can continue to be effective at the work that you do?
Thank you. This has been really great. And I know we're coming up to time, and we just wanted to share a few additional pieces of information. Bear with me one moment as we share our screen again. So today, again, we've had such phenomenal conversations with our panelists, and this has been incredibly informative about why we want to put attention and focus on this topic and on this intersection of violence. And today's conversation has really deepened our understanding of why the two fields must collaborate and work together, get rid of those silos. And in honor of Domestic Violence Awareness Month, we want to continue having these conversations. As Sasha said, this can't just be an October conversation. This is something that we want to continue having throughout the year. We are, in honor of Domestic Violence Awareness Month, we are releasing a white paper specifically on the topic, exploring the intersections of community and intimate partner violence. This white paper is going to be emailed out to all the participants in today's webinar. We hope you get an opportunity to read it, to share it, and also begin conversations in your own communities. This is an opportunity for us to continue our work in violence prevention and in intervention in our communities. We're calling on you all to bring on additional voices to the table. And these voices can help problem solve together to intervene and also prevent violence, especially as it relates to community and intimate partner violence. If you're interested in learning more, we welcome you all to visit the National Network for Safe Communities website or email us for additional information. This has been a really fantastic conversation. Want to give our panelists a huge round of applause for everything that they shared today. And I hope this is as motivating for you all as it has been for me. And just want to thank everyone for today.
And thanks to you, Fatma, for your wonderful facilitation and organizing of the panel. We deeply appreciate you. And thank you to my colleagues and all of you who joined us. It's been a wonderful way to start this conversation.
Thank you for the invite, Sasha and team.
Thank you.
Thanks, guys. Take care.
Thank you all.
You too. Bye.